children with acute lymphoblastic leukemia have to undergo intensive chemotherapy, which requests to stay in hospital for several weeks after the first diagnosis. However, it is very, very important to support not only the children, but also the families. And we have recognized that even within Europe, the information, but also the supportive care for these young patients is quite different. And I want to show, together with my colleague Adele Fielding from the United Kingdom, an overview and an interactive discussion on the different levels of supportive care within Europe. Also asking the question, what are the age limits within the different countries, and how, for instance, transition, but also supportive care, not only in the hospital, but also at home, could happen. And I will show a very, very interesting project on our mobile nursing team, which is coming home and which allows patients, but also families, to lead a more normal life than in the hospital. We have performed this kind of home care since several years, and it is a highly accepted procedure. The background is that the nursing team is part of the hospital team. And of course, they are completely integrated in all documentation systems, but also in the daily ward rounds. And they have a high responsibility, not only for themselves, but of course also for the patient. I want not only to discuss this possibility for patients who are in phase of treatments, but also in a phase of palliation. And I only can underline how important and how wonderful this kind of support is. Especially since the pandemic, we have increased the number of our nursing team. And of course, it is much more convenient for the patients and their families to stay at home and not to travel and be in ambulatory care, where a lot of hurdles and time-consuming testings and waiting time is a big challenge for these patients.